Many people say things like, I'm so OCD because I like everything neat. At first, that sounds harmless, but it shows how misunderstood OCD really is. Being clean or organized does not mean someone has OCD. Obsessive-Compulsive Disorder is a serious mental health condition that affects how people think, feel, and behave. It is not about personality or habits. It is about anxiety and fear that feel impossible to control. People with OCD do not choose to act the way they do. They struggle with unwanted thoughts and feel forced to perform certain actions to calm their anxiety. Understanding what OCD truly is helps us show empathy instead of judgment and encourages those who suffer to seek help. OCD has two parts. The first part is called obsessions, and the second part is called compulsions. Obsessions are unwanted thoughts or fears that repeat in a person's mind and cause strong anxiety. For example, someone might fear that they left the stove on, hurt someone by mistake, or got contaminated by germs. These thoughts come suddenly and are very hard to ignore. Compulsions are the actions people do to feel safe or reduce anxiety. These can include washing hands many times, checking locks repeatedly, counting, or arranging objects in a certain order. Performing these actions brings short-term relief, but the fear soon returns, creating a painful cycle that is difficult to break. OCD is not about being careful or clean. It is about feeling trapped by thoughts that will not go away. There are many myths about OCD. One myth is that it is only about cleaning or washing hands. In reality, OCD can involve fears about harm, morality, numbers, or even personal identity. Everyone's OCD looks different. Another myth is that people with OCD do not know their behavior is irrational. In fact, most people know their fears do not make sense, but their anxiety feels so strong that they cannot stop. It is like their brain keeps warning them about danger that is not real. It is also wrong to say OCD is a personality trait. It is a mental health disorder that can cause distress and interfere with everyday life. People with OCD are not too careful. They are struggling with real and painful fears. OCD is linked to how the brain works. It is a neurobiological disorder, meaning it is related to brain chemistry and structure. Certain parts of the brain that control decision-making, movement, and emotions function differently in people with OCD. The disorder is also connected to low levels of serotonin, a chemical that helps control mood and impulse. OCD can run in families, which means genetics play a role. Stressful life events or trauma can make symptoms worse. Even though we do not know exactly what causes OCD, we know it is not the person's fault. It is a medical condition that can be treated and managed. Living with OCD can be exhausting. People often spend hours each day fighting their thoughts or doing rituals to feel safe. This can affect work, school relationships, and daily routines. Something simple, like leaving the house or finishing homework, can take much longer than normal. OCD also affects emotions. People may feel ashamed or afraid to tell others what they are going through. They may hide their behaviors or avoid certain situations. Over time, this can lead to sadness, loneliness, or depression. It is important to remember that OCD does not define a person. With the right help, people can manage their symptoms and live happy, meaningful lives. The good news is that OCD is treatable. One of the most effective treatments is cognitive behavioral therapy, especially a method called exposure and response prevention. In this therapy, people gradually face their fears without performing their usual compulsions. Over time, their brain learns that nothing bad happens and the fear fades. Medications such as SSRIs can also help balance serotonin levels and reduce anxiety. In severe cases, doctors may suggest other treatments like brain stimulation. Recovery takes time and patience, but it is absolutely possible. Many people with OCD improve greatly with the right support and care. If you know someone with OCD, the best thing you can do is be kind and patient. Never tell them to just stop or calm down. OCD is not something they can control by willpower. Instead, listen to them, offer support, and encourage them to get professional help. We should also be careful with how we talk about OCD. Using the word casually, like "I'm so OCD," makes the condition seem like a joke or personality quirk. Being respectful helps reduce stigma and shows compassion for people who live with the disorder. OCD is not a choice, a habit, or a sign of weakness. It is a real mental health disorder that causes unwanted thoughts and behaviors. But with the right treatment, people can learn to manage it and live full, peaceful lives. When we understand OCD, we replace ignorance with empathy. When we talk about it openly, we help others feel less alone. Everyone deserves understanding and care, no matter what they are going through. OCD does not define a person. It is only one part of their story. With knowledge, treatment, and kindness, recovery is possible. The more we learn, the closer we come to a world where people with OCD are accepted and supported, not judged or misunderstood.